Hello, today I am going to talk to you about a disease which is known as glaucoma. Glaucoma is a disease which affects people all around the globe, and in our country itself it affects around 1.5 crore people, out of which 10% have already lost their vision totally and irreversibly because of this condition. The reason of giving more importance to knowledge about this disease is that if not taken care of properly and at the proper time, it can lead to permanent irreversible blindness. So what exactly happens in glaucoma? Glaucoma is a very slow disease. Gradually the nerve of the eye, the optic nerve, deteriorates its function, slowly going towards blindness. The most important factor contributing to this deterioration of the optic nerve is what we call intraocular pressure. As you know very well, the eyeball is like a balloon. The pressure of the fluid inside the eye is what we call intraocular pressure. In patients with glaucoma, by and large, the pressure of the eye becomes too high for the nerve, and the effect is the nerve gradually dries up and progresses towards blindness. So the unique problem with this condition is that the early stages of the disease, the patient has no problem, no indication, no complaints at all. Therefore, the patient doesn't want or doesn't think of going to an eye specialist for a checkup. It is only when the disease has progressed to a very late stage that problems in vision appear and patient comes to the doctor. Very often it is very late, the doctor does his best to save the vision, to treat the patient, but it would be a lot better if we could catch patients, identify the patients at an early stage and intervene appropriately and prevent this from going to an advanced stage. The other thing is that when you treat it early, it is easier to treat, it gets controlled better, and it is a win-win-win situation for everybody. So we need to know, number one, who are the patients who are at risk of getting this disease and what we should do about it. So anybody is at risk of getting the disease, but definitely people who are older than 35, 40 have a higher risk. And if you have a first degree relative, a parent or a sibling who has the problem, your chances of getting this disease increases quite a bit more. So if there is anybody in the family who gets diagnosed to have glaucoma, we insist that all blood relatives and siblings need to go for a regular eye checkup. Besides that, even if you don't have any family history, it is a very advisable idea to go for a routine eye checkup when you turn 35 or 40 and ask your doctor specifically, what are the risks of me getting glaucoma? Are there any indications today that I may be getting glaucoma in a later stage? And if there are none, then you need to repeat the test after maybe a couple of years or 2 years later. But if there are some signs, it's not necessary that you can always tell very clearly that you have glaucoma. The reason is, the second problem with this disease is that there is no single test which can confirm that you have the disease, especially in the early stages. Just like you have diabetes where you do a blood sugar check and it is clear that you have it or you don't. In glaucoma there is no single test, especially in the early cases, which can confirm clearly that you have the disease. So we have many people whom we label as glaucoma suspects. The glaucoma suspect list is usually 5 to 6 times more than the number of patients who actually have glaucoma. So you can understand that out of the glaucoma suspects, not all are going to get glaucoma, but definitely this is the group of people who need more intensive observation, repeat tests, and this may continue all through their life. But it is a good investment because blindness is a terrible thing to have, and therefore it is very important that every person, whether he is living in the city or he is living in a village, needs to have periodic eye checkups from a qualified person specifically targeted at looking at early signs of glaucoma. Nonetheless, to say more, if you have family history, this importance is even more than other patients. What does one do after you know that you have glaucoma? The usual glaucoma treatment in the early stages is in the form of putting eye drops. But I always insist and try to make people understand it is a partnership between the doctor, the caregiver, and the patient and the relatives of the patient. To keep this a success story, you need to have a good coordination between all these players, because it is going to last all through life. It is not a treatment that you take for a few weeks or a few months or a few years and you're cured. You need to maintain the care and the observation tests all through your lifetime. So, number one is to have the appropriate tests done periodically. What are these tests? You have the visual field test or perimetry, and you have an optic nerve examination which is done by the doctor, as well as sometimes machines are used to screen the optic nerves. And these tests are repeated periodically over time to tell us whether the disease has stabilized as we want, or it is not stabilized and it is progressing at a very slow pace, in which case we can take more measures, more intensive treatment to get our aim of stabilizing it. Besides eye drops, there are other modalities of treatment like lasers and even surgery. All the treatments, whether it is drops, laser or surgery, are aimed to reduce the pressure in the eye, which is the key risk factor in damaging your optic nerve and leading to progression towards losing your vision completely. The treatment of glaucoma involves putting eye drops, which need to be put regularly. That is the next important thing for patients to understand. These eye drops all have a duration of action. So if you have put an eye drop today, right now, there are some eye drops which lose their effect in a few hours. So another drop has to be put. There are other drops which last for 24 hours and you need to put it only once a day. But if you do not put the second drop, the following drop on time, what you get is the eye pressure starts going up again, and many times this low and high and low and high eye pressure damages the nerve even more. So you need to keep putting the drops as advised by the doctor, regularly at the intervals advised by the doctor. So make sure that you have adequate stocks with you and do not miss eye drops. It has been researched amongst the people who lose vision despite treatment that a large percentage of these patients are the ones who are not putting their drops as advised and not having their tests periodically as advised. A lot of patients will be able to save their vision, to stop the glaucoma, if they follow these two things very properly. And definitely the patient's relatives need to understand that, because all of us require a little boost from our near and dear ones to do what needs to be done and do it properly. And I am quite certain, with proper care and proper understanding of the disease, this team can save vision. It is not necessary to be losing your vision completely due to this disease. A lot of patients can be treated and treated better if caught early. So have proper tests, and once you know that you have glaucoma, have the treatment which is advised by the doctor appropriately. So after hearing this little talk, I hope that there has been more clarity in the understanding of what this disease is all about, and that we can partner better and control this disease at an earlier stage, stop people from losing eyesight, and have good vision for more people as time goes by. Thank you.